This is John Carlo. I'm a physician from Dallas, Texas, and I'm on the COVID-19 task force for the Texas Medical Association.
Great. So with the rise of Omicron, and at least here in Austin, we moved back to more restrictive policies that have been in place because of the pandemic. Do you see the definition of fully vaccinated changing at all? I mean, to go from Pfizer, Moderna being 2 shots, J&J being 1. Do you see boosters coming into play in that definition at all?
Yeah, that's a great question. I would answer it by looking at what we're trying to accomplish in terms of protection. And so right now, the CDC, of course, defines fully protected as having received the initial 2-dose series of the mRNA vaccines or a single dose of the Johnson & Johnson. But we do know that a booster is recommended, particularly for the Omicron variant. So depending on what you're trying to accomplish, really, I think defines whether or not you consider just having the 2-dose series without the booster protection being fully protected. I believe that at this point now, the booster is really important. So I would consider that as an important part of being fully protected. But I know that there are certain situations where it may not necessarily make sense to include that booster as being fully protected.
As part of the COVID-19 response team for TMA, is that a conversation that the team has been having at all in terms of, whether to endorse that idea of having the booster to be quote unquote fully vaccinated?
Well, right now there's a lot of other things that are coming into play here. And I think that while the booster recommendation is certainly an important addition and one that we're all recommending and certainly feel that that's an important part of overall safety, I think the key to this is whether or not what we're using that term fully protected to be for, So I believe for individuals that protection really does include the booster recommendation. If we're looking at it from a proof of immunization or in certain situations where you're having to show immunization in order for passage into certain activities or things like that, that's a different story and a little more complicated. So, I look at it from the basis of individual protection, and really the recommendation right now is to go ahead and get those boosters. But as far as defining that full protection for all those purposes that we're looking at right now, that's a complicated question to answer.
And we've seen a lot of people, especially with the holidays, now that we're in the middle of the holidays, having trouble finding tests, having trouble, finding boosters that they can get immediately, as opposed to scheduling it out a week or whatever the case may be. Because of that, we've also heard stories of people going to emergency rooms to try and either get tested or get the booster or get their first shot because they haven't been able to get it in a timely fashion. Have you seen that? Is that something that you've seen, in your hospital?
Well, this unfortunately has caught up with us a lot quicker than I think many have expected, particularly during the holiday season. What we're seeing is a lot of people who are either planning to be more around family members or who are traveling or who are realizing sort of at the last minute that in order to travel safely that it's possible that a booster needs to be added or a test needs to be added this week. And a lot of people are trying to do that and are running into roadblocks because there's so many people that are doing that. So I think that there is concern overall because what we're seeing in Texas is the Omicron variant has arrived and it definitely is here. So we're seeing a lot more people that are sick, thankfully with mild illness because we have a good degree of protection with our vaccine. But that does not mean that we're not troubled by the fact that we're seeing a lot of people sick and we're heading into the holiday season where a lot of people want to go out and do things and realize sort of at the last minute that a test is needed or an additional booster might be helpful. And so we're definitely seeing a rush on those resources and just are concerned overall about the holiday traffic in general and really limiting that so we can be safely through this together.
With the holidays almost over, I mean, we got a few days until the new year. Do you anticipate the demand for boosters or first-time vaccinations or tests to slow down?
I think what'll happen is as we see more and more people who are getting sick, that's going to increase the demand overall. So not only during the holiday season and with the holiday traffic, it's very likely that after the holidays, when we start seeing even more cases, that demand could go up even further, especially as we're seeing more and more people around us who become infected. So I don't think we're through this yet, unfortunately. I think we have a ways to go. And just really the next couple of weeks, I think in Texas are going to be absolutely critical in terms of how quickly we can recover or reach this peak of this current Omicron wave that we're about to head down towards.
And I know this is kind of asking a lot, but obviously this is the third widespread, I guess I'll say, strand of COVID-19. Do you think there's going to be more coming down the road?
Well, I certainly hope not. I think one thing we've learned through this experience together is that this coronavirus is remaining a formidable foe, and it continues to produce these variants. And so I think if we're using our recent past as an indication, unfortunately, it does show a high likelihood of introducing constantly new variants and going through this. So unfortunately, what we've seen so far is not a good indication of what's to come. But with that being said, I think we all remain perplexed overall, and just in terms of what we can predict and what we don't know in terms of the coronavirus and what it's going to do next. So, it remains a unfortunate open question that we don't know the answer to. But it remains a perpetual worry for those of us that see so many infections occurring and watching these waves come and go. It's just another part of where we're going to have to see a future where we're comfortable in understanding kind of what's next. So a lot of unknown, unfortunately, and I wish I knew the future, but it's certainly the immediate past does cause us to be concerned.
And I apologize for not asking this before. You said physician. Do you have a specialty?
Public health, preventive medicine.
Okay. And what's your message to those who have gotten a vaccine, but maybe not their booster yet?
I think that what we've learned so far is the vaccine is doing great. It's doing good in terms of offering critical protection at the time we need it the most. But this coronavirus is continuing to change, and we have to continue to adapt ourselves in order to meet that new demand. And so this booster, the boosters that we are now doing, is really the best measure, the best medicine that we have in order to stay up in front of this and really advance as this coronavirus is advancing upon us. And so what I would say is if you have gotten the series, go ahead and get the booster, go to that extra mile, because the coronavirus itself is certainly making that effort as we're watching it spread and introduce new variants. So we've got to do our part to stay up and stay in front of that. And the good news is it's very safe. It's very effective. We're seeing great results with people who do get the boosters. And so I think it's an important step that we all need to take right now in order to stay up in front of this as we continue to see more and more coronavirus cases.
And with more and more cases, we've seen them growing at an increasing rate, if not exponentially, over the past few weeks. What we haven't seen as much compared to the other Delta variant and the original COVID-19 strain is as quickly of an increase in regards to ICU hospitalizations. What does that tell you as a physician?
Well, we want this to be good news, and I do think that we're all watching this very carefully, and we want to jump to that conclusion that this is a less severe variant, that we're not going to see as many hospitalizations because either we have a greater degree of vaccine protection, or this is just not a severe variant of causing more severe infections. We're still too early to make that definitive conclusion. Certainly, we've seen some good signals in places like the UK and South Africa, where we've seen perhaps some indications that it's less severe. But overall, what we're trying to deal with is not just each individual case and the likelihood of severity, but the overall population as a whole and the number of people that are sick at one time. So even if you're in a situation where each individual case isn't as severe as the other variants, if we have more people sick at the same time, that's still going to result in the same effect in resulting in more hospitalizations than we can keep up with. So while I think so far we see encouraging news, I am very, very reserved in saying that this is not going to be a problem, particularly for our healthcare system, because there's certainly other ways other than severity to reach a threshold of where we can't manage enough hospital beds and capacity.
And one last question here. What are your thoughts on the CDC's recommendations that recently came out regarding the 5-day, 10-day quarantine, the changes that have been happening in those recommendations?
You know, I've been struggling with this, to be honest. I think that we all understand the dynamic place that we're in right now and the tremendous amount of uncertainty, particularly around this really, really critical question as to how do we recommend somebody that has been sick, that whether or not it's safe to go to return to work, return to family activities and things like that. And under this climate of uncertainty, it's really, really difficult to understand how we can best make the best decisions for all the different possibilities that are out there. And where I'm struggling the most right now is in healthcare settings in particular, do we have a different set of guidelines or standards that we need to be thinking about, particularly if we're working with patients that have lowered immune systems or other medical conditions that would put them at higher risk? I don't know the answer to those questions about whether the 5 days is enough and whether we should do testing in those situations. So I think that overall, what I hope to hear from the CDC is a little bit more detail on where this recommendation is applying and perhaps where there's conditions where it's not going to work. And stay tuned to really understanding kind of what's happening on the ground so that we can best make decisions on how we can really move forward together under these really, really uncertain conditions.
Has the uncertainty challenged the credibility of health leaders, CDC, throughout this pandemic?
That's a tough question. This is a perplexing situation where we want to be adaptable. We have to be comfortable changing our recommendations at a moment's notice because, we learn more things along the way. And the importance to this is to be flexible and adaptable as we gain more information so that we can quickly make changes as effectively as we can. The overall effect of having those messages change, yes, it can greatly cause an overall sense of whether or not we are keeping overall ahead of this in a situation of maintaining our response to, collectively and understanding kind of how we're going to move forward together. I don't have an answer to that, in front of me. I wish I did, but I would say that when we're doing this, we're doing the best we can in terms of the information that we receive. And I just hope that, as we go through this together, we look at it from a perspective of, this is the information we knew, this is the information we know now, this is why we've made the recommendation changes, and this is how we're going to get through this together. And ultimately, it doesn't do much good to undermine, our most important credibility right at the time of a crisis. We're all in this together, I think, and I'm just hopeful that we continue to keep that message in front of us and continue to make the right decisions at the right time.
All right. Well, Dr. Carlo, I appreciate your help and thank you for being available today. I know it's a tough time and, especially with the holidays, it's really busy right now.
It's busy. I'll tell you, that's right. Well, no problem. Good to see you and have a good new year.
You too. Thanks so much.
All right. Thanks.